So, effective healthcare, whether it's in the U.S. or any part of the world, involves some form of engagement with stakeholders of a variety of different kinds, whether we're talking about clinicians or patients or caregivers or managers or administrators or payers or employers in the U.S. It is a team sport. Until we can find good ways of having people work in concert, we're never going to develop the solutions that we need to find. So the discussions have been really invigorating. They are the real substance of this conference. I've amazed at the kinds of insights that people can bring up. Mostly, I often judge conferences by how many new ideas I get, and by that standard, this is at the top, because really people are coming at things from perspectives that I haven't seen before, and I've got a lot that I can now bring home. So I talked about the role of behavioral economics in health and healthcare, and behavioral economics is a relatively new field that aims to blend the best of thinking from economics and the best of thinking from psychology. If there's a key lesson in behavioral economics, is that many of the decisions that people make, whether it's a physician or a patient or a caregiver or a manager, aren't based in the kind of rational models that our policies are designed for. Often we make decisions based on errors of judgment or forms of irrationality. And until we understand that irrationality, it's going to be very hard to design effective programs to help people get the health and health care that they need. If there's a key lesson in behavioral economics, though, it isn't that people act irrationally. It's that people act irrationally in highly predictable ways. And it's the predictability of that irrationality that allows us to design tools to overcome it. So I think a lot of what I've heard is fundamentally about what might be called human-centered design, designing for what patients actually need, what physicians and providers can actually provide, rather than a kind of idealized design for people who are doing exactly what they're supposed to be doing at all times. People often don't do exactly what they're supposed to be doing at all times. They do what they typically do. And human-centered design in general is a design that incorporates that kind of understanding. We need to be bringing healthcare to where the people are and not asking the people to come to where the healthcare providers are. Today in healthcare, whether we're talking about the developed world or the developing world, it's often framed almost in terms of clashes, that there are stakeholder groups, people who pay for healthcare, the patients themselves, the people who deliver healthcare, and often it's described very oppositionally. And I think that this conference in particular is leading us to a way to align incentives, align goals, and recognize that in most cases we're actually on the same side, on the same team. So the real hope would be that in 20 years' time, the conversations are much more inclusive about how we can work together to get someplace, as opposed to bemoaning the fact that we are sometimes working in different directions.